So we're talking about a case report for plantar fasciitis today. We've discussed some self-assessment things in the previous couple weeks. We know foot pain is not always plantar fasciitis. We know plantar fasciitis can be mimicked or can be caused by several other things. One of the things that can be causing that is an issue from the low back. We talked about a little test where you can sit up straight, straighten your leg out, flex your toes, flex your ankle. If that recreates the low back pain, there's a good chance, if that recreates your foot pain, there's a good chance that your low back is actually causing your foot issues. We looked at another thing called hammer toes. We look at see what the toe muscles are doing. Are the toe muscles fully functioning and doing their job, or are they a little weak? They need a little help, or are they overloading the plantar fascia and actually causing a true plantar fasciitis? The other thing we discussed is calf size. Sometimes on a previously injured leg, history of ankle sprains, history of bone breaks on that side, or something along those lines, or even having a foot in a boot previously, but that can cause some weakness in the calf muscles themselves. The calf muscles are very important in what's going on at the foot and in the ankle itself to help support the plantar fascia. And sometimes we just need a good strength training and rehab program to get the calf muscle up to snuff. But today we're going to discuss a case presentation of a friend of my wife's and I. She's been having some issues with one of her feet. She does lots of running and sprinting for what she does, and has been having some issues as time goes on. So we did some working up on her. We checked to make sure it wasn't her low back. We checked to make sure it wasn't coming from a foot or ankle issue. We checked to make sure that all of her muscles and everything were firing well in her feet. We checked her individual calf strength on each side. We had her do as many calf raises on one side as we could. Then we compared that to the other side, and she was pretty close and pretty equal on both. So one of the things we for her, we just needed to have time to do is her body needed more time to actually get through her training and rehab program to get more strength built up in the muscles that were helping to support the plantar fascia. The other thing we looked at was the calf muscle size. We looked at it from the front, the back, and the sides, and the affected side, the painful side, did have a little bit smaller calf. So we're thinking that probably plays into what's going on calf-wise itself. In the clinic, there's lots of things we can do for that to kind of help support pain relief and get things moving. On the chiropractic side, we get joints moving really well. In the low back, we get joints moving really well. In the feet and the ankles, we can do lots of soft tissue, different maneuvers. We can scrape it with an iStim, A-stim tool. We can do dry needling. We can do ART. We can do a bunch of different stuff to get the muscles to try to relax and calm down. We're on the rehab side. You do that stuff at home to get we walk you through exercises and have you work on them at home to get things firing better, getting stronger, getting more endurance, and getting better. And then also sometimes we need to consider sending this out to somebody else who's got some stronger stuff. And typically that's going off to someone to get an injection, to get some steroids, get some other medication in there to help get that stuff calmed down, because we need to get things calmed down sometimes before we can get things to rebuild. So that's our little case series for plantar fasciitis, a true plantar fasciitis. Not all foot pain is plantar fasciitis. Hopefully that's also something we've kind of driven home. But getting a thorough assessment on what's going on is the most important part, because from there, once you get the thorough assessment, you can actually plug it in and start getting the right treatment plan and the right exercises and stuff in place. When you're just randomly trying out exercises, and just doing different things, it's not working a lot of times. There's something else going on, and if you need a good set of eyes, we're in the Kansas City area. We'd love to help you out. Feel free to reach out and or give us a call.